Hi, this is Alyssa Jane, and I have case study A1, which investigates Alzheimer's disease. So, background information about Alzheimer's: it's the most common cause of dementia, and it's a progressive degenerative disease that destroys memory and causes a decline in thinking, behavioral skills, and social skills. Causes of Alzheimer's are brain cell death, which is due to clumping of protein amyloid plaques in the cerebrum. The genetic mutation that leads to this is a point mutation in the amyloid precursor protein, or the APP gene. Other cases of Alzheimer's are due to a mutation in the PSEN genes, but the one that we're focusing on is the APP gene. So the mutation can either occur on codon 693 or codon 717. And on 693, it's the glutamic acid to glycine mutation due to the loss of an M-bol site. And for 717, it's the gain of a BCLI site, changing valine to isoleucine. So usually the protein would form peptides that are secreted and bind to acetyltransferase to promote transcriptional activation. However, this mutation causes peptides to form amyloid plaques in the brain instead. Regarding heredity, people can get it with either one copy or two copies. Two copies increases the risk. Familial cases are autosomal dominant, and other cases are recessive. And Alzheimer's can even occur in the absence of inherited factors. For genetic testing, both mutations are tested through a southern blot. And for the 693 mutation, the DNA is digested with the M-bol site, and a southern blot is performed using an APP probe. So for the 693 mutation, it's due to a loss of the M-bol site. So to test, it's digested with the M-bol enzyme. For the 717 mutation, it's digested with BCLI enzyme because it's due to the gain of a BCLI site. And the mutations are on the APP gene, so an APP probe is used because the probe binds to complementary segments. For a description of the case study, Martha is showing symptoms of dementia and is hospitalized, and her children, Sam, Joan, and Robert, want to know her prognosis and if they are at risk for Alzheimer's, if it's the familial form. So the results from the 717 mutation is that no one has the mutation. Lane 2 shows the distance that the mutation would be, and every other line lines up with the normal APP gene in lane 3. Therefore, no one has the 717 mutation, and everyone is homozygous for normal traits. For the 693 mutation, lane 1 shows what the 693 mutation looks like, and lane 3 shows the normal gene. So looking at where the mutation is and where the normal gene is, therefore Joan and Martha are homozygous for the mutation, and Robert is homozygous for lacking the mutation. So Robert is normal, and Sam is heterozygous. So conclusions regarding the testing is that Martha has the 693 mutation. Her children, Joan, inherited 2 copies, and Sam inherited 1 copy. So concluding regarding Martha's diagnosis, she carries the point mutation in the APP gene regarding the codon 693. She has a loss of an M-bol site. Therefore, she has the familial form. And by having this mutation, she's at risk for passing the gene down to her children. Regarding her children, Robert does not have either of the mutations, so he does not have the disease. Joan has the 693 mutation and is homozygous, so Joan has the disease. And with the mutation being autosomal dominant, Sam has the disease as well, since Sam is heterozygous. And issues raised with this type of DNA testing is that Southern blot requires a lot of high quality DNA and sometimes has issues regarding that. And Southern blot testing is being replaced a lot with PCR testing instead. Regarding populations where the disease occurs more frequently, of course, Alzheimer's occurs in the elderly population, 65 and older. But regarding ethnicity, African Americans are twice as likely than whites to have Alzheimer's, and Latinos are 1.5 times as likely as white people. So, regarding the follow up questions, giving a demographic of who has Alzheimer's, and researching with several peer reviewed articles. So, aging is the strongest risk factor for Alzheimer's. So, the higher your age, the more likely you are to have it. Symptoms usually begin in mid 60s, but there are such thing as early onset Alzheimer's, which begins anywhere between 30 and 60 years old. So you're most likely looking at grandparents that you're going to be treating or diagnosing with Alzheimer's. And factors that can increase the chances of Alzheimer's are cardiovascular factors, so diabetes, heart disease, and obesity are good contributors to Alzheimer's, which increase the risk. And through research, it seems that women are more likely to have Alzheimer's due to the fact that women have a higher life expectancy than men, so they have a higher risk for Alzheimer's. And women also go through hormonal changes with their reproductive life, which could have an effect on their risk for Alzheimer's. For any rare cases that could make a deduction wrong or difficult when determining Alzheimer's, early onset cases are more difficult due to the fact that Alzheimer's affects mainly old people. So in early onset cases, it's a little harder to determine. And some cases some diseases can be confused with Alzheimer's. So if people are showing symptoms of Alzheimer's, they could just be seen as for experiencing depression, side effects from medication, a brain tumor, withdrawal, a vitamin deficiency, and sometimes the diagnosis of Alzheimer's can be missed at an early onset age. So to warn a patient that has Alzheimer's, they should be made aware of the progression of their disease. So Alzheimer's develops slowly and gradually, but worsens over the years. And by the end, it will affect most areas of the brain. So memory, thinking, judgment, language, problem solving, personality will all be affected. As for symptoms, mental decline, forgetfulness are the main symptoms. A lot of times there's people that have difficulty understanding, confusion, disorientation. A lot of times they can't complete simple tasks. Sometimes even personality changes and behavioral changes occur with aggression, and in bad cases, people are unable to combine muscle movements. So things to avoid are a bad diet, which increases the progression of dementia. And also, if you find out in an early onset case, you should try to avoid having children because your children are most likely going to inherit Alzheimer's. So more information to provide to the patient about treatment, lifestyle changes, a cure, and research. As of now, there's no cure at the moment, but some things that could help or exercise is seen to improve, to lead to cognitive improvements. Patients should be made aware that they need to make arrangements and research nursing homes, care professionals, and inform their family that they could be at risk and that they might need to care for the patient themselves. Regarding treatment, there's research with neural stem cells and neurogenesis where the disease highly affects the neurons of the brain, and scientists are investigating if neural stem cells can be utilized for neural regeneration of the brain. Another treatment that a lot of people are prescribed through medication when they have Alzheimer's are certain inhibitors that can be used as treatment. Experiments have been done to show that these inhibitors might be potent and are an anti-Alzheimer drug. They tend to reduce symptoms and improve mental function, but aren't necessarily a cure. They just make the Alzheimer's a little bit less drastic of a disease. And here are all of my sources for my peer review articles that I used. And thank you.